Good evening. The human heart. What an amazing organ. You probably heard me if you were here for my liver talk and for my pancreas talk that I think every organ is amazing, and it truly is the case. However, the heart is special, and every organ is special, but the heart is extra special, I believe. If you think about the human heart, we all kind of see this picture of a heart, right? Have anybody had the experience to actually witness the human heart beating? Are there on TV? Okay, so you saw it on TV. That's fair enough. That's fair enough. I actually had the privilege to see it in person in heart open surgery, and it truly is. It's like a miracle, to see this precious organ. It's pretty small. It actually is pretty small, around a fist. And the heart doesn't look anything like this. It actually has 4 chambers. Well, kind of. And it's so intricate and complex as far as, the heart has its own nervous system. And if you think about the physiology and just the heart as a pump, right? So it has this function of distributing blood and oxygen to the whole body. And pretty much this starts happening about day 21, 22 in utero. So think about it, this little tiny, not even formed fetus, yes, it's an embryo. And all of a sudden, day 21, the heart starts beating. And truthfully, the scientists today, they actually, to this day, they do not know what triggers the heartbeat. I mean, we kind of have our own ideas, but as far as scientifically, there's no chemical, there's no change, and all of a sudden the heart starts beating. And ever since that moment, the heart keeps beating. And actually, by the time we're born, it will beat about 54 million times just by the time we're born. And then, depending on your heart rate and your lifespan, 3.2 billion times is the number that the heart will beat throughout our lifetime. That's kind of huge. And if you think about it, right? If you think, it's like, wow, kind of like take a moment and soak it in. And in a way, when I think about it, when I think about these numbers, the quote comes to mind from Hafiz. I don't know if you've seen it, probably. It's a famous poem of his, where he says, after all this time, the sun never tells the earth, I owe you, and then he goes on and says, what happens with love like that? It lights the whole sky. And truly, I think about the heart as an organ like that, because it keeps beating, and it, whether we are running, sleeping, breathing, or holding our breath, it's there for us. And if you think about it physiologically, it's so intricate, and about 50 to 80 times a minute, this huge system has to, pretty much the blood goes into these atriums, right? And then there's these valves that have to close for that period of time. And in the meantime, these ventricles are actually contracting and sending the blood that was there into the lungs to get oxygenated, and then into the whole body to bring the oxygen in. And then these valves, they're coming out, then they close, these open, and this atria constricts, and these ventricles open, dilate, and it's this complex that happens so fast. And if you think about it, if you kind of think about your heart, every time I kind of see the heart, and I kind of post it on Facebook, there's a picture, so if you want to go on my Facebook page, facebook.com/Dr. Katka, you actually will see the heart there beating, and sort of will make you wonder. So that's the physiological part of the heart. There's so many aspects to the heart, and what I try to do here, and I'm going to turn this page over, and you may not see everything that's on there, so don't worry. No panic there. This basically is me trying to take this complexity of the heart and the heart health and kind of put a structure to it. So basically what I'll try to do is speak from the traditional model of how we look at the heart and heart health and heart disease. Then from the alternative or the natural model, and again, if you don't see, don't worry, I'll cover everything. And then there's this energetic model. Because the heart truly is in Chinese medicine always has a different look at our body. And in Chinese medicine, the heart is considered the ruler. It's considered the most important organ in our body. And actually, they call it the monarch. They call it the heart is the monarch, and it rules all the organs, and it actually houses the mind. So in Chinese medicine, the heart is above the mind. And the truth is that from the moment the heart starts beating in the embryonic state, it is, as I said, was the first organ to form, and it starts actually sending chemicals and different substances into the whole body, and kind of starts synchronizing the body way before the brain is actually formed. And there is an amazing institute which you might have heard of, Institute of Heart Math. Anybody heard about it? Yeah. And they work closely with the Institute of Noetic Science, which is similar. There's an amazing movie if anybody is interested in looking more into this, because I won't have time to go into this whole energetics of the heart, but The Living Matrix is a really good movie, and you can find it online. And maybe, I know Charles sometimes does like a movie night here, so maybe that'll be a movie to look at. But one piece that kind of goes with Chinese medicine, Chinese medicine is old. It's 2,000 years old, and they already kind of knew it back then. And most recently, this Institute of Heart Math, they are coming up with so many experiments that actually say that the heart is the master organ, that the heart actually does rule the brain. They have many experiments. One of them is that actually both the brain and the heart, they're able to kind of predict or feel, the waves change prior to the event occurring. So let's say they have different pictures of people are watching. Some are happy, and some are really scary, and some are sad. And what they're seeing, that the body is perceiving, the brain and the heart, they're both perceiving what comes up on the next picture prior to the picture coming up. But the very interesting thing that really kind of brings a bigger picture to this, that it is the heart that perceives it first. It's actually before the brain. So what they're really kind of implying and saying that the heart really is this governing agency in a way. I kind of call it the conductor of the orchestra, because it is the wave of the heart, the pulse. If you think about it, every 50 to 80 times every minute, the heart sends this pulse waves through the whole body. And what happens, it actually synchronizes the whole body. And the emotions are a huge way how the heart communicates with the whole body and the brain. The emotions actually start in the heart, and then the heart sends chemicals to the brain. Then the brain creates the emotion, or we think about the emotion, or we feel the emotion in the brain, and then the chemicals go from the mind, they go to the body and create, let's say, the fear or the love. So the very interesting piece, and we'll kind of come back to it as we move through these different models. But the very interesting part that they're finding is that heart health and healing in general has so much to do with the electromagnetic field of the heart, which, by the way, is the electric field is 60 times of the heart is 60 times larger than the brain. And the magnetic field is 5,000 times larger than the one of the brain. So it's really magnificent there. But what they're finding is that something they call the heart coherence. Heart coherence, there is actually a global coherence initiative, and what they're finding is that there is, and I have this beautiful machine that comes from heart wave, where you can kind of measure your own coherence. It's pretty simple, where it tells you green, you're in coherence, blue, you kind of in between, and red, you're not. There's a little picture which you probably won't be able to see. Do you see this kind of, sort of? So the one at the bottom is when we feel positive emotion. So see, it's very much synchronized. It's basically love, appreciation, gratitude, understanding. And the ones above, they're very kind of chaotic, are the emotions of anger and fear and truly in judgment. So they're, like I was saying, the heart sends these messages, and our whole body responds to these emotions. So, as you will see down, when we talk about this, emotions and stress are huge in heart disease. Actually, much bigger than this poor cholesterol that got such a bad rep. So let's talk about a little bit about the cholesterol and the numbers. So traditional medicine is very much about numbers. And I know firsthand, because 6 years of medical school in the Czech Republic, it was all about numbers, right? And how do we bring the numbers down? So blood sugar is high, blood pressure is high, cholesterol is high. Therefore, there must be a risk of heart disease. So what are we going to do? We're going to bring all these numbers down, mostly, with medication, sometimes 2 or 3 or 4 or 5 different medications or more. So I have patients come in and their numbers are perfect. Are they healthy? No. And actually quite the opposite. I have patients that have high cholesterol and they are in perfect health. And we'll talk about that, because cholesterol is not, it's not the bad guy. It's not the cholesterol. But it became all about numbers. And if we want to talk numbers, heart disease has been on the top as far as the biggest killer, right? The number one killer has been there for quite some time. The number one killer is heart disease. With more medications, still number one killer. So what I would like to do is kind of go back and forwards between the traditional and alternative model. Because where we're coming from in the traditional medicine is that actually cholesterol is the problem. That's really where we're coming from. The truth is that cholesterol is vitally important to every single cell in the body. Every cell with a nucleus, which is the center in the cell, produces cholesterol. So if you think about it, if every cell in the body produces cholesterol, can it be a toxic substance? Cholesterol actually is very benign in of itself. They did an experiment where they took purified cholesterol and they injected the blood vessels of animals with cholesterol. Nothing happened. Pure, straight cholesterol got injected into the blood vessels. No atherosclerosis, no heart disease from that. It's not the cholesterol in and of itself. It really is all that happens around the cholesterol. It's all that happens with the cholesterol when it gets oxidized, and it's what happens on the wall of the endothelium, which is the inside lining of the blood vessels. So that's really the bigger picture. Because going back to cholesterol and its crucial importance, it is so important that body produces most of its cholesterol. It's not really the food necessarily that we get it in. It's only about 15 to 20% is the external cholesterol we get in. 50% gets produced in the liver, 15% in the gut, and the rest kind of in the skin. So what happens in the skin, especially here in Arizona, the cholesterol in the skin changes into vitamin D. So that's one crucial part, vitamin D. Stress hormones such as cortisol, cholesterol is the precursor. Sex hormones, testosterone, estrogen, progesterone, cholesterol is the precursor, right? So think about that. If we're stressed, cholesterol levels very much will go up because the body needs the precursor for the stress hormones. And actually, the very interesting piece is, if you think about blood draw, cholesterol can be up to 65% higher during stress. That's quite interesting, right? So think about it when you go for your blood draw and you have a really high cholesterol. Was it a really stressful day? So there's so much to just thinking about the stress and the cholesterol. Mm-hmm.
So years ago when they started the bad guy, there was the argument between dietary cholesterol, eating cholesterol, and then factors that we ate that overproduce cholesterol in our own body. Isn't that where the trans fats came into?
I will talk about that. I will talk about the trans fats.
The body make more than it actually needs.
It's
I don't know if that's true.
Actually, when we decrease the external intake of cholesterol, so it's eggs and meat and dairy, it's only animal products that have cholesterol. Plant products will not have any cholesterol. That's why when you see in cereal, cholesterol free, you're thinking, yay, right? But it's because plants don't have cholesterol. It's nothing special, right? It's free by nature. But it's more like when we take less in, the body produces more. And when we take more in, the body produces less. So it actually really regulates it. That's how important cholesterol is. I think what you may be implying is what happens with the cholesterol when it kind of becomes toxic in the body. So I'll talk about it. Yes.
Don't eat it, and then suddenly, you can eat cholesterol, but don't eat the things that your body makes too much.
I'll get there, Wendy. I'll get there. Absolutely get there. So the last piece I want to mention before I move on is cholesterol and brain. Cholesterol and brain. So brain cannot actually take the cholesterol from the liver or from what we eat or from what the gut produces. Brain has to produce its own cholesterol. And because cholesterol is actually the outside of every cell, the cell membrane needs cholesterol. Without it, the cells, they wouldn't function. And there are special cells in the brain, they're called the glial cells, which are supportive cells of the neurons. And what they're responsible for, they make cholesterol, so brain has to make its own. And they also are responsible for plasticity, which means, the synapse is growing and it's actually learning and memory. So what you're going to see with some of the cholesterol medications, and I'll come back to it, but I'll mention it right here, is they cross the blood-brain barrier. And especially the Lipitor, the Zocor, the Mevacor, the Crestor, and the Vytorin. So those are at the top list. And what happens, because they cross the blood-brain barrier, they actually decrease the production of cholesterol in the brain. So the side effects of, let's say, Lipitor are not only the muscle aches and the dizziness and the weakness and the insomnia and actually the chest pain, okay, and then the abdominal pain and diarrhea and nausea and urinary tract infection. And I could go on, but lots of infections and flu-like symptoms. So besides that, for years, people have been complaining of memory loss, cognitive dysfunctions, and depression while taking this medication. And it truthfully wasn't until this year, the beginning of this year, that the FDA finally came out and said, on top of all of these other side effects, Lipitor and some of these other ones can cause memory loss, cognitive, dysfunction, depression, and diabetes. Actually, and increasing blood pressure. And right now, just Lipitor, Zocor, Mevacor, Crestor, yes. So what you're going to see is actually a lot of people that are diabetic or pre-diabetic and their cholesterol numbers are a little bit higher, preventatively get put on Lipitor. I see it all the time, right? We'll give you prevention Lipitor, and then we give you prevention, metformin for your blood sugar. There's a little bit of a, side effect kind of mix going on there. So very important. Remember that if you or anybody else are on cholesterol medications, those would really be. Actually, cholesterol medicine, I don't agree with, and I'll be very upfront with you, because cholesterol medicine is one of the harshest medicine on the body as far as what it does and how it, like I said, how it blocks the natural pathway on the cholesterol, and then this questioning on, is it even needed? So we'll talk a little bit about it, but cholesterol medicine is the easiest one to get off of, and it's the one I love the most to help people get off of. Very easy. But think about the other piece here. Lipitor has been, since 1996, when it came to the market, it has been the best-selling drug, the bestseller for the last 10 years, making $125 billion for the company that produced it. $125 billion. It was the first drug that crossed the $10 billion market in 1 year. Actually, last year they made $13 billion just last year. Actually, it's coming off patent, so you're going to see this company is really creating some major strategy to keep it going. But with that said, on the other side of it, what I have seen in my practice, and that has been, 18 years of really medical exposure, so 8 years out of that was practice, 10 years was medical school, the reference range has been going down for cholesterol. When I first started, and even here in the United States, right now the so-called bad cholesterol, the LDL, is you should be below 99. A few years ago, I remember it was below 130 was still okay. So that's a huge jump, right? And it actually takes a lot. It takes a lot of effort to bring cholesterol down, 50, 60 points. It takes a lot of medication if we just take this particular approach over here. Yeah, and the other piece with this, and I'll kind of touch on that later, is if you think about drug companies putting out, medications, they only do very short-term studies. They do 6 months, year, 2 years, whatever is kind of allowed. They only need to give the FDA 2 studies that were kind of saying, this drug works. Yet they can make, they can create 100 different studies that they don't have to even talk about, report. So those studies are not long-term, and what we're seeing, these medications, when people are put on them, they stay on them, unfortunately. Same thing with blood pressure, blood pressure, blood sugar, cholesterol medicine. I see people that have been on them 10, 20, 30 years, right? What's happening in the body? There's like the medication Bicol for cholesterol. After 3 years, they have to recall it because it was actually causing fetal problems. It was causing, destruction of the muscles where people actually died. And some of these, they're still on the market, have the same side effect on the label. So with that said, it's kind of the sad part. With that said, all of these numbers, all of the cholesterol, is it even about the cholesterol? So let's go to that. As I said, cholesterol in and of itself, it's always floating through our bloodstream. 24/7, there's cholesterol everywhere in our blood, right? Because the cells are producing it, it's being brought to the cells, it's being taken out of the cells to the liver. So why do some people have atherosclerosis or the plaque, and why some people don't? So it has to do with the endothelium, as I was saying. Endothelium is actually kind of being considered, or they think about calling it an organ. Endothelium is the inner lining of the blood vessels. And if you think about a little piece of trivia, I was kind of thinking like how long are the blood vessels? How many do we have? And it's actually 60,000 miles for a child and 100,000 miles for an average adult. It's how many blood vessels we have. So what they're thinking is if endothelium is going to be an organ, it will be the largest organ in the body. So what happens on the endothelium? I kind of turn this over a little bit, and I'll go back to it. So there's your blood vessel. And the cholesterol just flows through the body, whether you are at 190 or whether you are at 250. It truly doesn't matter, because as far as heart disease go, people with cholesterol of 150, 60 still have heart attack. So that really the theory in and of itself, if it's just cholesterol, people would not have heart attack with low cholesterol. So it's floating, right? And it's doing just okay. But what happens is there are few things that start create this plaque buildup. One of them is the damage to the endothelium. And it can happen with a high blood pressure. So blood pressure being high can actually damage the endothelium. It also happens with free radicals. And we'll talk about it a little bit more. And if you were here for my liver class, free radicals are, they're everywhere because we live in a toxic world. And it's just toxins, chemicals, heavy metals, so free radicals. But the biggest piece with free radicals, and that's what Wendy was kind of pointing to, are fats, are trans fatty acids, are rancid fats and fried food. So those are filled with free radicals. And then on top of that, the immune system has to come in. Because if just damage happens, or, yes, the platelets come in and they start building a little bit of plaque, but it's the immune system has to come in. And what happens, it creates inflammation, because inflammation is a way for the body to try to heal this damage, right? Except the problem with the inflammation, so that's your inflammation, that's your free radicals. And that's the damage. She can read, but the inflammation happens, so the immune system comes in, and it actually starts kind of, this cholesterol that's here, it starts eating it, starts taking it into the cells and starts depositing it over here. The part here that's important is it's not just any cholesterol, it's the cholesterol that has been oxidized. So oxidized cholesterol it's basically inflammatory for the body, and so the immune system tries to go and get rid of it. So it is not the actual cholesterol, it's the oxidized cholesterol. And here is where the piece about diet comes in. So we're gonna talk about a lot of things to do, but you've probably heard in the last few years, about protein and protein theory for cholesterol. So there's this idea where we're coming from this lipid theory that it's the cholesterol that's the problem and it's the fats that are the problem. However, what is being shown and research is showing that it's actually the animal protein that is being kind of targeted as the biggest protein of this oxidized cholesterol. Because what happens when cholesterol is exposed to temperatures over 250 to 260 degrees Fahrenheit, it becomes oxidized. So therefore, if you think about how we cook meat, of course any fried meat, and anything fried, but in general, we cook meat at high temperatures. So there's one part there is the oxidized cholesterol coming in with the meat, and then the other part is the protein from meat has this particular amino acid which is called methionine. And methionine in the body changes into homocysteine. If you heard about that, but homocysteine is actually being kind of targeted by the research as that being one of the main problems of heart disease. It's high homocysteine levels, and that does come from the protein. So you have the oxidized cholesterol, and then you have the homocysteine. Both of them actually creating this damage to the endothelium when the atherosclerosis starts. So I don't know if you've heard about the movie Forks Over Knives. Anybody? Have you seen it? It's a very interesting movie. It actually talks about it. As far as homocysteine goes, homocysteine needs B vitamins, especially B6, B12, and folate. It needs those B vitamins to be able, so you have methionine, turns into homocysteine, and it can turn into cysteine. Methionine and cysteine are essential amino acids. We need them, but not so much the homocysteine. So when we don't have enough B vitamins, especially those three, and truthfully, when you take B vitamins, they like to be together. They don't like to be separated. Just you take B6 or you just take folate. They work together. They're catalysts for almost every single reaction in the body. So B vitamins, period. So if you think about our diet, okay, so we think about this protein, high meat protein diet, and then as far as going to the trans fatty acids, what happens is heart disease really started kind of increasing very much around the time when trans fatty acids were introduced into our diet. If you kind of look back, there is somewhat of a correlation, which is not really talked about or pointed at, but trans fatty acids or hydrogenated fats or polyhydrogenated fats, they are the worst and the biggest risk factor for heart disease. Actually, the research shows that increase in only 2% caloric increase of trans fatty acids equals about 93% increase of heart disease. 2% to 93%, right? So if you get rid of trans fatty acids, or at least 2% of trans fatty acids, you just decreased your risk for heart disease 93%. And here's what happens with that. It's one part is, yes, is the trans fatty acids are very oxidizing to the cholesterol. They're very inflammatory. They actually they have the free radicals. They create the damage to the endothelium. However, our body does not know how to break them down. Fats and healthy fats, we need them. We need up to 30% in our diet of healthy fats. And if you think about that, it's because fats are part of every cell. The brain needs fats. So if we don't take healthy fats in and we take these hydrogenated fats, which really what happens, the regular oil is exposed to such high temperatures, and then hydrogen, is brought in and creates hydrogen bond, and then solvents come in, and then it's being put in, this de-rancid, so it doesn't smell bad. So all of that happens with this oil. Our body does not know what to do with it. If you ever took a stick of margarine and left it outside, in the summer it would just kind of melt, but it would stay there forever. Nothing would ever happen to it. No bug would ever come near it. No, seriously, try that. It's basically very close to plastic. Margarine is very close to plastic. So what happens? It clogs up our blood vessels, and the body doesn't know how to break it down. So that's one part, and the other part is that heart, unlike the brain, remember the brain only can take as an energy blood sugar and glucose. It needs glucose and blood sugar. The heart can actually use fatty acids, whether they're the good ones or the bad ones. It can use those as energy as well. So if you think about it, the heart using these trans fatty acids as energy and putting them in the cells, it really weakens the heart. The huge part here, so I'm telling you all of this, and you're going to go home and say, okay, well, I'm not going to do fried foods, and I'm not going to do trans fatty acids, and I'm going to read all my labels. Great, that's pretty kind of easy. The important piece to remember is that there are these hidden trans fatty acids, and a lot of baked goods, a lot of pastries and then processed food, they actually have trans fatty acids in them. And on top of that, they have very often dried milk powder and dried egg powder and dried butter, right? So those already are, the cholesterol in those already has been exposed to the high temperatures, and it's already oxycholesterol. So you're getting this oxidized cholesterol, and you're getting these trans fatty acids in all this processed food. Remember, 2% calorie intake, 93% of increase. So really, if you think about it, we got to start thinking in this bigger picture and not just about cholesterol. So one of the big pictures is the endothelium and is the protein theory. So you have a lot in your notes as far as how food makes such a big difference in this. The other part is, and we'll come back to that still, but the other part is supplements, right? We always, people ask me, so if I don't take these cholesterol medications, what do I need to take? So one part that is very important to remember is what happened with cholesterol being the target of heart disease is what it created is this mindset that, well, if I take care of the cholesterol with something, whether it's a supplement or a drug, I'm going to be okay. So it's not as simple as, taking the drug out of the picture and putting the supplement in. It's this whole complex system. So yes, the supplements will help, and we'll talk about them, but it's still going to remain about the bigger picture here. As far as CoQ10, CoQ10 is a must for anybody who is on cholesterol medication, on statin drugs. So if you know anybody who is on Lipitor, Zocor, or any one of those, what these medications do, they inhibit this particular pathway, this HMG coenzyme reductase. They block the pathway where the cholesterol is at the end of the pathway. However, CoQ10 is part of that pathway as well. So basically what we're doing with cholesterol medication, we're cutting, decreasing the cholesterol, but we were decreasing production of CoQ10, which CoQ10 is one of the most important antioxidants and substances for the heart. For the heart, besides every single cell in the body, but for the heart. So if on these medications the dose has to be a little bit higher than taking the 200 milligrams, I would go and even take 400 milligrams CoQ10. You have it in your notes. CoQ10 is is not active, it has to turn into ubiquinol, which is active CoQ10, which is 8 times more potent if you take ubiquinol, so you can take a little bit less. It's now on the market, ubiquinol about 100 milligrams is going to be enough. But CoQ10 is the main, what it is responsible, it's responsible basically for energy production. There's this molecule called ATP, which stores energy. So it helps the immune system, it helps the brain, it helps exercise routine, it helps with everything. But specifically for the heart, that would be the number one thing to take. D-ribose. So the ATP molecule, the CoQ10 comes in and creates active energy ATP molecule. D-ribose is actually the center of this particular molecule. So it's the structure, it's the backbone. So what the research is showing now that CoQ10 and D-ribose together, they can actually restore some of the heart muscle that has been, what we think it has been dead after heart attack, but what they're finding is that it has been hibernating. And then high doses of these supplements can actually restore these muscles. Again, unfortunately, there's not enough research for supplements. So we don't have as much research as on the drugs, and very often supplements are being researched by the drug companies to show that they don't work. However, this particular research has been done by natural companies, and it's showing some amazing results. It's actually a naturopathic doctor who had a heart attack and had scan before and then scan after, where it showed the perfusion was actually back. So that's the good news, that the heart, even after heart attack, can recover. It's quite amazing, right? And if you add this whole energetic healing part to it with the love and gratitude, that's a whole different story. So those two, very important. We talk about the B vitamins. B vitamins always. Again, remember when diet comes in, when we eat processed food and when we eat white flour, it's void of vitamins. It doesn't have any B vitamins, versus when we eat whole grains, like the quinoa, the amaranth, the millet, the oats, it's filled with minerals, it's filled with vitamins, especially B vitamins. Because another piece of this theory and of what's happening as a heart disease is deficiency. We don't have enough nutrients, we don't have enough B vitamins and magnesium and calcium and zinc. That creates more free radical damage. So it's all connected, and again, it comes back to the food. It comes back to eating the green leafy vegetables with all the antioxidants and with all the minerals and vitamins in there. Vitamin C and E, actually, again, research has been done on those, and they have been shown to help with heart disease specifically. So, cardiovascular disease, vitamin C and E. Vitamin E has been sold for years as alpha tocopherol, which is only one of the many vitamin E's. So what you want to buy if you get vitamin E, you get the mixed tocopherols, where you get the alpha, the beta, the delta. So they actually work. They're more potent, and they work in conjunction. So always think the mixed tocopherols, about 800 IU, she have it written down there. Some other antioxidants, the amazing one is turmeric, which really kind of scavenging the free radicals that damage the endothelium. Garlic, the good old garlic for the heart. You've heard it. It has been, it's been talked about for a long time. Garlic has to have the active allicin in it to be actually potent. So don't just get any garlic. It has to have the smell of the garlic is the allicin. So it's best to eat it rather than taking it as supplements. We talked about the magnesium, calcium, potassium, very important for the heart. The electric impulses, they are all is the potassium and sodium, and then the magnesium comes in, and the heart muscle squeezing. It's all dependent on these minerals. Fiber and lecithin. Fiber and lecithin we talked a bit about during the liver class, but fiber, again, you go back to diet. If you eat whole food plant-based diet, you're going to have plenty of fiber. We do not have enough fiber in our diet today, so it does help to add some. You look at those potent fibers like the chia seeds, filled with nutrients and filled with again, the minerals. Flaxseed. Flaxseed is also an amazing fiber. Flaxseed seed and flaxseed oil are very different. So the flaxseed in of itself is an amazing fiber, and what it does, it binds the cholesterol. It binds the excessive cholesterol in the colon, and actually it allows for its excretion. Lecithin, and get the non-GMO like it's in your notes, lecithin helps to move the cholesterol out of the liver, out of the bile. So it actually moves it out, and then the fiber kind of gets it out. So those are very, very good supportive supplements for lowering the cholesterol. Magnesium is the #1 for high blood pressure. So for anybody with high blood pressure, magnesium would be the first supplement to put them on, because it creates vasodilation. It opens the blood vessels. And you can go pretty high with magnesium, up to 1,500 milligrams per day. But you have to be careful. Too much will cause loose stool. So you kind of find your own, tolerance, meaning how much can I still take and be okay with. So magnesium is going to be very important. Let's talk a little bit. Do you have any questions so far? And it's a lot of information. Yeah.
I do have one. You talk about calcium, magnesium, and potassium. And if you're taking supplements, how much balance should you put into all three of those in the supplements, or is that not an issue?
If you take a good multivitamin, like a really good multivitamin, it's going to have decent amount of all of them. However, if there is already, a little bit of high blood pressure, if there is a little bit of, let's say, depression, if there is a little bit of heart disease, or there's fatigue, or there's any symptoms, you want to add a little bit more. And what we have heard so much is we need calcium, we need calcium, we need calcium, right? So we have been taking 1,200 milligrams of calcium per day, which is a pretty high dose calcium. And what needs to happen, especially for women, the calcium has to be actually total daily calcium. So you got to look at how much is in my multivitamin and how much is in my food. If you do eat dairy, there's a lot of calcium there. However, the calcium from dairy, the body doesn't really process that well. You actually get more from broccoli. You get more calcium from broccoli. So, and seeds and all that. So you actually have to take all the calcium and put it together. So about 600 in a supplementation of calcium is great. What I see a lot in this calcium-magnesium combinations, or calcium-magnesium-potassium, there's always less magnesium. Except, as I was saying before in one of my previous lectures, 80% of us, in the United States, 80%, we're deficient in magnesium, and more so for women. So magnesium has been kind of the forgotten mineral a little bit. So what I like to see is at least the same amount of calcium and same amount of magnesium. And if you have any problems with a little bit of high blood pressure, headaches, insomnia, inability to sleep, restlessness, or cannot calm down, magnesium is really the go-to mineral. And again, you always look at good brands. So magnesium, like this one, for example, you're just going to get straight 400 milligrams of magnesium. It's almost like, look at, Charles actually has been so kind, and he has brought some of the top supplements here to Strong Wisdom, which I'm so grateful for, because one of the things I see all the time, is fish oil. Fish oil is actually, by traditional medicine decided that fish oil, yes, is good for heart disease. So it's actually being sold as a drug now, even, or prescribed as a medication for people. Which, when you look at the ingredients there's very little active ingredients and lots of other chemicals and colorings and all that. But even when you go to a Whole Foods store, you're going to look at fish oil, and it will say 1,200 milligrams of fish oil. So what that tells you is just how much fish oil is there. It's not going to tell you how much of the active EPA, DHA is there. And you have it in your notes. You want to go at least for 600 of the EPA and at least for 300-400 of the DHA per day, minimum. Okay, so you always need to look at how much you're actually getting of the active substance. And fish oil needs to be pure. Remember, it has to be, the mercury and the heavy metals have to be taken out. But fish oil is on the top of supplements for heart disease and preventing heart disease. So Did I answer your question with that? Okay, great. And you had a question, Dee?
I was just wondering about like flaxseed. If you buy it, like I just bought a big bag of organic flaxseed at Costco that's already ground. Is that not as good as buying the whole seeds and then grinding them yourself, like to use? Do you lose some of the?
You never know how long it has been that way, right? And then also with flaxseed, you taking it as a medicine in a way. You always want to go for the organic, and you know, I'm kind of the organic queen, and you've heard me talk about that. But always go for the organic when it comes to food. So ground flaxseed, if you get a big bag, you always have to refrigerate it because it can get rancid, and you're gonna smell it if it gets rancid. So you can use it, just use it fast. It's best to buy chia and flaxseed.
Ground to get the nutrients. Flaxseed must be ground to get nutrients, or it'll. That's one of the B vitamins, a good dietary source of nutritional. All the
Yeah, and the whole grains. Yes. Yes,
So
ma'am.
you're taking the flaxseed, you don't digest that, you're just using that for fiber.
You digest a little bit of it because it's soluble, which means, and it's insoluble. So some of it actually dissolves and digests, but most of it is the fiber. Yeah, yeah. But it does have omega-3, so fish oil and flaxseed oil. And there's actually new research coming up that possibly the plant oil, the flaxseed oil and the hemp seed oil and the chia seed oil, that may be actually more beneficial than the fish oil even. So going back to the oils real quick before we move on, is it's very important to have fat in our diet. You know, we have been taught the fat-free or low-fat. That honestly kind of started around the same time with the margarine and with the trans fatty acids. What happens with the fat-free is not only you're gonna get more carbohydrates in, and you're gonna get more of those, those oxycholesterol with the dry eggs and the dry milk powder, but it's like if you think, just kind of trying to see where to go with that. Anyway, lost the thought right there. So any more questions?
The B vitamins, how much is that?
Okay, so B complex is actually try to like 100 milligrams of each, unless you take something like these guys here are from Whole Foods. So they're actually whole food supplements. They're always going to have smaller amounts because you're going to be getting the broken down, the food, so it absorbs better. But usually you want between 50 and 100 milligrams of each. Okay, great. Any more questions?
So do you still recommend a B supplement if you're taking like those multivitamins?
These multivitamins, actually, they have plenty of B complex. Yeah. So you're good. Unless, there's some of the depression and the cognitive dysfunction and the brain symptoms, then extra B complex does help. Or if your energy is really low, adrenal glands, the stress glands, they really need B complex. So you're going to need a lot of B complex in those kind of scenarios. Otherwise, if you're doing great, then multivitamin is plenty.
So the B6 and B12 and affiliate together, or just
they come, if you want to do specifically, if you have high homocysteine level, and let's actually go to that, is there's some other tests that need to be done. So if your homocysteine level is high on your blood work, then, and your B12 and B6 and folate test low, which is what you can test, then you definitely want to supplement the extra B6, B12 folate. Otherwise, B complex works a little bit better as a complex altogether. Okay, so, yes? Thank you. That was exactly where I was going with that before. Thank you. You're reading my mind. So with the oils. So where I was going with the oils is that we need oils. And what happens is there are most of the oils are actually pro-inflammatory. There are certain oils that are not. One of them is coconut oil. One of them is ghee, which is purified butter. So it does Ghee. You have that in your notes as well. But it's purified butter, and then olive oil, and then flaxseed oil and fish oil. Those are not inflammatory.
What about avocado oil? I thought that was
okay for high heat too?
Avocado oil is not good for high heat. Coconut oil and the ghee, actually just the coconut oil, it's a saturated oil, so when it's exposed to high temperatures, it's not going to change its structure. So high temperatures exposure, coconut oil is okay. Unless you put the meat in there, then you're going to get the oxycholesterol. But you were asking olive oil. Olive oil is polyunsaturated oil. What it means that it has these open bonds, right, which are very healthy for us. So cold pressed olive oil is great. Or if you cook with it, if you saute, you can saute vegetables with olive oil. Always put a little bit of water in there to kind of offset the temperature, and do not expose it to higher than 212 degrees. Because when olive oil is exposed to high temperatures, it actually becomes carcinogenic and toxic. So olive oil is very healthy, but not when cooked with. It's the other oils. You can in ghee if you don't expose it to high of a temperature, and then coconut. Coconut is actually healthy oil. Do not cook with flaxseed or olive oil at high temperature. None of that. All the other oils, plant oils like sunflower seeds, sunflower oil, and safflower oil, and canola oil. Canola oil is actually not a healthy oil at all. It's quite the opposite. It's very, very unhealthy. So those oils are those rancid oils. They're those that create the inflammation on the endothelium. They're the ones that bring the free radicals and cause the damage. So oils are really important in nuts and seeds, in avocado, and in some of these other oils, but not the trans fatty oils or not the rancid oils. So that's why you really want to start looking at what is in your ingredients and the food you eat. And always assume when you're buying something processed, it's going to have those oils.
And is coconut oil always solid?
It's not always solid, but it does solidify. But under, like if you leave it right now in Arizona.
Warm it up and use it?
Say it one more time, Charles.
Then you warm it up and use it.
Yes.
I mean, the only time I've ever seen it, it's actually looks like Crisco or something.
Yeah, no. You can, if you put it in a refrigerator, it's going to be hard. But right now, if you leave it outside and it's a little warm, it's going to liquefy. Right. It's very easy. So you take it with a spoon and you cook with it. Yeah.
I think it's like 76 degrees.
Mm-hmm. It becomes, yeah, there you go.
So here wouldn't be a problem.
Here wouldn't be a problem. No, if you take it out, it's actually going to be too liquidy. Okay, so I want to move on if it's okay. Yeah? So the very important part that I want to get to is, and again, there's so much, okay, but you have as far as the diet goes, you have all of it in the notes. But what I want to move to is, so if you take, the traditional medicine, right, and it's the cholesterol part and the blood pressure and the numbers, and then we move over here, we talk about the diet. Diet is a big one. So if you take statins, they only have, and that's relative, okay, considering that cholesterol is really the problem, they only have 24% of reduction in cardiovascular risk. That means, you need 125 people on cholesterol medicine for one person to actually have a reduction. And vice versa, you take 100 people, 3/4 of them will not have any effect. So that's another myth, thinking, I'm taking cholesterol medicine, I'm okay. No, it's only 24% effective. So when we move to this area and really look at the core of what's going on, so we have the diet and dietary changes. So you think 24% on the cholesterol medication. Then we move to diet, and we're getting 65-75% reduction just with diet, okay? And then we move to movement. I'm not even going to call it exercise, because exercise is like, oh, I got to exercise. No, any kind of movement. Our body is meant to move. So movement/exercise actually has 100% reduction of cardiovascular disease and coronary artery disease. 100% reduction on a regular exercise. And once a week exercise, 25% reduction once a week. So it's even more than statin, right? So if you start exercising every day or 5 times 5 times a week, that's like the best thing you can do, you know, so much better than any medication for, hold on one second, for cholesterol and even blood pressure. Exercise is the best for blood pressure as well. So you get your magnesium, you get your exercise, 100% reduction. Then you add the third piece to it, and that is stress. Stress, actually, 90% of chronic illnesses are thought to be due to stress. And that's actually, this model recognizes it. Stress reduction is a big one. It's 200%, if you do all the study, 200% reduction in coronary artery disease with reducing stress. So if you think about that part, you have this 24% here with the medication that causes so many, side effects. Some of them are actually lethal. And then you have all these things you can do at home. Do they take time and do they take effort? They do. But this not only heals coronary artery disease and heart disease, it prevents it. It's the whole prevention, not wait for the diabetes to come in, not wait for the heart disease to come in. Because you think about stress, do you know when most heart attacks happen? Have you heard that? When most heart attacks? 9 a.m., 8 a.m. Yeah. So the heart, the body has its own rhythm. It knows time, but it doesn't know Monday versus Saturday, right? So on Monday, really. And when you take this stress together, there's this huge cascade of what happens during stress that I don't have time to go to, but it's, it's cortisol. And in a way, this the cortisol, the cholesterol is needed for the stress. So it's so complex. But the other part of it is the mental, emotional well-being. It is so huge. I have this question from the book, which is really amazing. This, by the way, The Myth of Cholesterol, and you have some references in your notes. This is the best book about cholesterol. If you're still doubting anything about cholesterol being or not being part of it, this is the book to read, okay? The Myth of Cholesterol, Paul Douglas. But I'm going to read this question here. A man has a heart attack. Which of the following factors will most accurately predict a second heart attack in the next 6 months? 1, whether he continues to smoke. We shouldn't even get there, smoking and alcohol, big one for heart disease. Whether he continues to smoke, whether he's depressed, whether his cholesterol remains elevated, whether he follows up with a cardiologist. What do you think is the answer? Depression. Depression is a big one, and that's where we kind of go over here. Anger, fear, anxiety, depression. So many studies show that couple hours before a heart attack, people had some serious anger episodes, or that being scared to death. Fear, anxiety, anger very much precede heart attacks. And then you take depression. Depression is a big one. And that's where this whole love, gratitude, energetic heart comes in. They actually started noticing that about depression. And, just kind of go back. Remember, the Lipitor can cause depression, right? So it's like, ooh, right? Look at that way. So depression was recognized as a risk factor, so people were being put on antidepressants, which didn't help actually at all. So it wasn't really the depression and suppressing the depression. It was really what's happening in this bigger picture here, right? And truthfully, when they take, this was a huge reduction, the 200%. When you just think about, the heart and the loneliness versus being part of a social group and having somebody, even having a pet and going for a walk a couple times a week, that's a huge difference. So remember, even just doing 10, 15-minute meditation every day, they're showing 90% reduction. So those key pieces to take home is, remember, exercise, 100% reduction. Diet, 65 to 75% reduction. Stress, 200% reduction. And then what they did is they kind of put it all together because they combine. They're cumulative, right? So cumulatively, they were responsible for 400% reduction versus your 24. just to, kind of leave you with that, it does really come back to the basics. It really does come always back to the basics. The supplements are very beneficial, but if all these are not in place, we're still putting a little Band-Aid on. So that's what I really want to leave you here with. I don't have time to go here, but it's a little bit more interesting information we'll touch next time. What I would like to do, or actually let me take like a couple of minutes because this is really interesting. The other part, it's like if you think the exercise, diet, and stress reduction, the other part I want to add to the Lipitor that is happening right now in our traditional medical world is aspirin. Aspirin is another medication that has been given to every single person with heart disease or to prevent heart disease. And so just like Lipitor has its own side effects, aspirin has its own side effects. Even baby aspirin, it's kind of being sold as candy. And actually, aspirin, just to give you a little trivia, 40,000 tons of aspirin are being sold worldwide. It's the most widely distributed medication, which is actually over 88 million pounds of aspirin per year, right? So here you have your bestseller, and here you have your most widely, distributed medication that has so many side effects with bleeding and allergies. But the other part about aspirin, that it can actually cause big hemorrhagic strokes, but it can actually cause these little microbleeds, those little tiny microbleeds in the brain. And what they're kind of possibly finding is that can be predicament or predictor of dementia and Alzheimer's. So it's prescribed because it basically stops the platelets from clotting. So it supposedly prevents, the clotting on the blood vessels, which it does, but it prevents clotting everywhere. So there are these microbleeds and, bleeding in the stomach and the small intestine. So just think about it on the bigger picture here, aspirin creating these microbleeds, and then Lipitor and other cholesterol medications having this, effect on the brain with the memory loss of cognitive dysfunction, and we have this skyrocketing amount of people with dementia and Alzheimer at such much younger age. So it's something there. It's always a bigger picture to look at. It really is. And therefore, every time you can take this number and bring the number down with medicine model and bring it to the basics. What does the body know to do when you give it what it needs? And then you add that extra energetic support here. That's it. That really is it. So what I would like to do, one question I'll take.
If someone is on those cholesterol meds, can they just stop them, or do they have to be transitioned out?
I cannot prescribe anything here or tell anything here, but cholesterol medicine is one of the easiest to get off of. It does help to be under doctor's supervision. It is best to go slowly. Just cut down slowly, because the body will naturally bring the cholesterol up before it regulates it, but they're pretty easy to get off of.
Yeah, I know my mom's been on
Yeah.
it for years. So.
Just slowly, but pretty easy. And I would transition with something like that.
So does traditional medicine, we don't have any of that, do they ever mention diet and all the other?
It's not taught in the medical school. Nutrition is not taught in medical schools. So, they do mention diet a little bit, but it's very, cholesterol medicine should be over here after, like in the books you look at, do diet and exercise first and then cholesterol medicine. And it's not happening today. You go on the cholesterol medicine right away. So you have in your notes, real briefly, there are some other tests to test besides cholesterol, and that's the homocysteine, and that's the B12, and that's the folate, and that's the C-reactive protein for the inflammation, and the vitamin C, and and then fasting insulin, fibrinogen. You are already down for you. So when you go see your doctor, have them test that, because that's much better marker of what is actually going on underneath than the cholesterol. It truly is. And if you need some help, second opinion, I'll be happy to do that for you. But those are the numbers to look at.
So the CRP, which is the inflammation
Mm-hmm.
marker, if it tests really high and your doctor says, well, that's nothing, that could be just that day.
Absolutely something. It's absolutely marker of inflammation happening, and and it can be brought down very much with diet and exercise. And sometimes what I do with patients, I add extra, so I do the chelation and I do the IV nutrients because it's so much faster. But the CRP will go down when you do all of this.
So it's not like
it is
within hours. It could be one, or the next time it could be
not
12.
not like that. No.
Okay.
Yeah.
So my doctor poo-poos things.
It's hard. There is not a medication to bring down C-reactive protein. So very often we don't look at these as much.
Right.
But anyway, you have that in your notes. Take that to your doctor. That is really something to look at. Okay, what I would like to do in the next few minutes, unless you have any more questions? Burning questions? Does that make sense so far? I mean, did you get some? I mean, if you don't remember any of it, just go like from this model to this model to this model, right? It's like, do you have to choose? No, they can all be done together. Like if you want to stay on aspirin, then you take extra vitamin C and you take extra SAMe and deglycerated licorice. You take like these 3 things that 90% decrease the bleeding side effects. You can always take something from here to offset this. You don't have to choose, but it's always going that way. It's going to be going toward health. Okay? Great. So what I would actually like to do in the next few minutes is go a little bit over here with you to that coherence. And I don't know, I don't think we can use my machine here, but I was actually at Greg Braden's seminar last year, and he had the coherence machine that actually on the computer where everybody was able to see. And what happens with the coherence with the heart, it's your own field is connected to everybody else's field, right? So when one person is in coherence, it affects the other person, affects the other person, and the other, and the other. And then as we do it here, the few of us here, it actually, that's how, if you think about how can I change the world, that's what Heart Month is talking about. It's you being in that state of love, gratitude, appreciation, understanding, without judgment. That's how you change the world. That really is it. It's like it spreads, and they have these measuring units all over the world, and they have this global coherence. You can sign up and be part over 24/7. There's somebody on in this coherence. It's kind of neat. So on top of all of these, this is the big one over here. So let's kind of go into the meditation, which will help to decrease the heart rate and the blood pressure and all that. And just kind of close your eyes if you will. There's a lot of information that you just kind of you were exposed to. So I'm going to ask you to do is bring all your attention in the center of your head. Just kind of see like this ball of light in the center of your head and pull all your attention from the past and everything you heard. Pull it back into the center of your head from the future. Bring it in. And just trust that what you're meant to remember, you will. Or if you need to hear it again, you will. As some part of you heard it anyway. So you can let that go and just be present. And focus on your breath. Let's see if you can breathe into your abdomen. You can even put your hands on your abdomen. You have your feet on the ground, so imagine the earth, actually the energy of the earth. It's coming up through your feet. It's coming all the way through your feet to your heart. And imagine this beautiful energy from the universe coming from above through your head into your heart. And they're kind of meeting in the center. And this monarch, this ruler, this director of the orchestra, of the whole body. All I'm going to ask you to do is really kind of feel the center of your chest. So bring the ball that you have felt and you're feeling in the center of your head, bring that into the center of your chest. Just drop the attention to your heart. You kind of feel this expansiveness in your heart. And just marvel for a moment there at all that you have learned about the heart and how magnificent it is that it's working 24/7. Just think about this beautiful organ and just feel some gratitude. Because you're here because of your heart, because of your heart beating from day 21. And you can choose to put your hands on your heart, you don't have to, but I want you to really feel is this beautiful golden ball of light in your chest that's being fueled by the energy of the earth, by the energy of the cosmos. And it's expanding in your chest. It's actually expanding through your whole body and out of your body. It's creating this beautiful, kind of like a golden egg around you. As you're feeling the gratitude towards your heart, I want you to almost imagine, remember those beautiful waves of the coherence kind of coming out of your heart in all directions. And they're kind of meeting and touching the people around you. And they're moving outside of the room. Into the whole city of Phoenix and beyond. And right here, right now, there's somebody in the world that is doing the same thing as you. If you were to go online, you will see them. They may be in Japan or Australia. Kind of notice them and feel the energy. Feel the power of all of us doing this at the same time. See if your light actually goes brighter, just feeling that. Being in love and gratitude truly is the most powerful place we can be at. For ourselves, for our health, for our intuition, for making decisions, for being connected to ourselves and the universe and everybody else. And it's so simple, just focusing into our heart. You can do this everywhere, anytime, 2 minutes, 10 minutes, everything will matter. Just give your heart a final stand-off with love and gratitude. Final hug. And keep the ball of light in the heart. You don't have to turn it off. Just keep it there. Kind of let it sit in your being and expand it outward as you open your eyes and take a deep breath. Doesn't it feel good? It's a whole different shit. We should have done this at the beginning. Next time. Next time. Okay, great. So truly, remember, that is the biggest piece of healing we can do, for any kind of illness, not just heart disease. So you have a lot to take home. You have lots of notes to kind of bring you back to this. I kind of try to take so much information and bring it in 2.5 hours, but you have a lot to digest. What I would like to do in the next 5 minutes is kind of give you a little heads up as to what I'm doing, so you can be part of it if you choose to. Charles was talking about the monthly series. They are going to go through the end of the year. And then, that's going to be it for now. But I want you to know the next one is the colon and the lymph system. So we'll really, and it starts at 7 o'clock, instead of 7:30. So it's a big change. We'll do the fall winter time. What I really want to bring your attention to is the immune system in October. It's going to be 10-10 on the 10th. Today's 8-8. 10-10, I like those numbers. The immune system, if you are somebody who gets the flu shot, I'm going to tell you not to do it, but I'm going to ask you to wait until you come to this class.